Hello, everyone. Okay, we're now starting our live session with regard to OET speaking subtests, and we will be talking about signposting today. So we're just gonna wait for a few others to come in, and then we'll get things started. So for today's session, we are going to look at the importance of signposting. Okay, lovely to see you guys today. So good morning, good afternoon, and good evening to everyone, wherever you are based right now. For those that are already here, I wonder if I can ask you, please, if you could share your name, where you are from, and whether you are preparing for OET as a doctor, a nurse, a pharmacist, or any of the other professions who take OET. I will give you a few moments to input that in the chat. And if you're just joining us right now, if you can just type it on chat as well. Thank you very much. This will give us a chance to understand a little bit more about your needs and your backgrounds. Okay, so hello to everybody who's joined us or will be joining us later on. Hello for those that are watching us from the UK, our students from the Philippines and in China and various locations in the Middle East. We normally have quite a few of you in here. So SGR is happy to be back to welcome all of you to another OET All-Star presentation. My name is Grace, and I'm one of the teachers here at SGR Focus Training. We are a company based in Scotland in the UK, and we have training centers in the Philippines. We are proud to be OET's first and only all-star premium preparation provider in the country. And joining me today in the chat will be Teacher Tess and Teacher Rob, who will be ready to answer your questions. So, before we begin, let me introduce myself. My name is Grace. I am the Managing Director and Lead Trainer for SGR. I have been teaching OET since 2017. So that's about 7 years now. And I've completed many teacher training courtesy of OET. As mentioned, SGR is an OET premium preparation provider in both the UK and the Philippines. We offer OET training mostly to nurses, doctors, pharmacists, occupational therapies, physiotherapies, and other healthcare professionals who require our support in preparing for the OET exam. Many of our students, nurses comes from the Philippines. We've got nurses from Thailand and China. We've also got Nepal and India. And we've got nurses from the African countries as well, such as Nigeria, Ghana, Botswana, South Africa, and also in Europe, we've got Polish nurses and Romanian nurses. For our doctors, they're mostly coming from Egypt. Hello to all my Sudanese doctors. I've got quite a few of you, Pakistan, Bangladesh. We've also got doctors coming in from Russia, Brazil, Italy, Spain, and a few others. Okay. For today's session, we will be looking at OET speaking and the importance of signposting. So, signposting is all about organizing the conversation in a logical way, clearly indicating when you change a topic and using techniques to make your explanations clear and organized. Now, in OET speaking, we always need to make sure that our patient can understand very clearly where the consultation is leading in and why. It's always a good idea to make sure that our patient can clearly understand the different topics that we will be discussing, or the type of questions that we will be asking them during that time. So, what we will be teaching you today will focus on the format and structure of the speaking subtest. We will also very quickly just talk about the speaking criteria, and then we will move on to the highlight of today's lesson, which is talking about the different stages of the patient consultation and how do you practice signposting, especially in different medical scenarios. Talking about the opening, the transitioning, how do you transition or move on from one topic to the other, and then finally, how do you close the conversation? And towards the end, we'll tell you a little bit more all about SGR and how we can help you achieve a pass score in your OET speaking exam. So for today's class, we're looking to learn how the format and structure of the OET subtest is, and then we look into learning about the different stages of the patient consultation, as well as learning how to use different signposting strategies and techniques to structure the consultation. So let's get things started. If anyone is able to let me know, what do you think is the format and structure of the OET speaking subtests? Okay. Okay, if you can type on chat. Okay. So the speaking subtest takes about 20 minutes in total, and it consists of separate parts. So you've got the ID check first, then you've got the warm-up conversation, and it is then followed by the 5 minute of role play. Only the role plays will be assessed in speaking. Before the role play begins, your identity, as I've mentioned, will be checked first, and then a short warm-up questions will then follow for that one. You take the professional role, and then the interlocutor takes the role of your patient or your carer. Always remember that in OET, the patient or the person that you will be speaking to during the role play will always be an adult. So if you've got a patient who is 16 years old and under, they will mostly be written in the role play card as a patient, but the interlocutor will most likely take the role of the carer or the parent or the older brother and sister during the role play. Now, for this part, your role play card includes details of your patient's condition and what you should cover in your role play task. Now, you will notice that we've got the setting, the background in the middle, and then the different tasks down at the bottom. So the setting basically tells you where you are working. So in this example, you are working in a GP clinic, okay? And then the background of your patient will be written in the middle. You can see in here that it tells you that you are a practice nurse. And then it gives a little bit more information about your patient as well. So for this example, we've got a patient who's had an abnormal blood test result. Now down at the bottom, you will notice that these are different tasks, okay, separated by different bullet points. So during this time, what you should take note of is the different verbs written within the task. So we've got explain, find out, explain, and emphasize. Your first task, okay, apart from doing task number one, is just to, during your preparation time, is to make sure that you understand what are the meanings of these verbs that OET will be using inside the task area. So explain simply means that you're going to give information to your patient. Find out means you are going to ask a question. You will notice that you then have another explain after that. And then for your last task, we've got emphasize. So emphasize, very similar to your explain, but in this instance, we will be using some grammar signposts or grammar or vocabulary that tells the patient that whatever you're discussing is very important. So during this time, your job is to make sure that you take the 3 minutes of preparation properly. So during this time, what I would advise is to make sure that you have written, okay, some notes within your role play task paper that will guide you on how to initiate the conversation with your patient. So you can write little notes such as good morning, and then the name of your patient. And then basically, if you want to mention your name, write my name is, or I am Dr. Smith. I am the GP on duty today. Or if you are a nurse, or say for example a pharmacist, and the patient has been referred to you, then you can add your doctor asked me to, etc. So it's always a good thing to have ready phrases that will guide you throughout your role play. Remember that the role play card will not be taken from you. Okay, you are allowed to write on it, you are allowed to underline, you are allowed to make notes. So also during the actual role play itself, it is a good idea that, say for example, you're running out of things to say. It's a good idea just do a very quick look in your role play card, look at the notes that you've left behind for yourself earlier, and then that's what you're going to use in order to make sure that you are able to continue with your conversation. Now, apart from making sure that you've got the introduction correctly, it's also a good idea to make sure that we have little notes about our phrases that we can use in terms of the verbs. So for example, for the word explain on your first task, I can write, before we start, I would like to explain. Okay, so always make sure that you are prepared, and also give yourself a little bit of a support, and basically coming in from your notes, so that you're not reading the role play task word for word. Okay, so in this instance, I've removed the word explain, and I've written, before we start, I would like to explain. And then that's something that could guide you during that time. For find out, typically it's, ask a question. So you can say, may I ask, okay, what do you know about increasing iron in your diet? Or you can say, before we begin, I would like to know, if you know anything about increasing iron in your diet. Simply the word find out means you're going to ask the patient a question, okay? And then for the next explain, again, make sure that you've got a word synonymous with the word explain, or another paraphrase. We've used I would like to explain earlier. Don't use that again, because again, what you want to do is to evidence to OET that you've got good grasp of grammar and vocabulary. That means that, using a synonym for explain, using another paraphrase would be quite good in here. So is there anyone who would like to give me another word or paraphrase of how they can start the consultation using the word explain in here. How about Zakir? Okay, is there anyone? Zakir, how would you start the explanation for this third bullet point? Okay, yeah. So in here, you can see that I've removed the word not a long-term solution, and then I've changed it into a short period only, for a short time only. Again, I want to evidence to OET that I can use synonyms, that I've got good vocabulary, or I can use grammar during my speaking role play. And then towards the end, I would like to use the words or the phrase such as and like instead, in order to tell my patient that I'm going to be giving examples. Okay. So I hope that is clear. If you have any questions, please feel free to type on chat. And I've got Teacher Rob who will be assisting you today. Another thing that you can do during your 3 minutes of preparation is to highlight any words that you do not know the meaning of. Okay, so asking for meaning and definition is a definite okay during your time of preparation. So for this example, I've highlighted the word inhibit. Okay, so if this is a word that you've never seen before, or maybe you've seen it but not really sure exactly what is the meaning of it, this is something that you can ask your interlocutor. You can say, excuse me, may I ask what is the meaning of inhibit? Okay. Your interlocutor is allowed to give you the meaning or definition of it. So it will say inhibit means to hinder or to prevent something. Okay, so in this instance, it means that these different types of food can prevent the iron from being absorbed in your body or in our body. Okay, another thing that you can ask during your 3 minute of preparation is asking for pronunciation. So in this instance, I have highlighted IRON. Okay, so if this is a word that you probably know the meaning, you've probably pronounced it before, but you're not entirely sure how it is pronounced. This is the perfect time, during your 3 minute of preparation, to ask the interlocutor for the correct pronunciation. So you can say, excuse me, Miss or Mr. Interlocutor, can you please tell me if I am pronouncing this word properly? Is it pronounced iron? Okay. So in that instance, your interlocutor might say, yes, that is correct. That is the correct pronunciation. Or your interlocutor might say, you're almost there, it's not right, the correct pronunciation is iron or iron. Okay, there's two different pronunciations you probably heard me say. One is in American, okay, that's spelled with the R, and the other one is the British, wherein the R is kind of silent. Okay, it doesn't matter what pronunciation you're using, as long as it's understandable and it is done correctly as well. So it's a very good idea to make sure that, again, prepare yourself with the phrases that you would like to use within to start the conversation. Secondly, replace the verbs written in your task area with phrases or synonyms that you can use during the role play. Number three, as I've mentioned, you can ask, or you are allowed to ask for meaning and definition. And then you are also allowed to ask for pronunciation. If you want some clarification, this is also a good time as well to ask the interlocutor. So once the preparation time finishes, the 3 minutes, you cannot ask any of these questions anymore, because by this time your interlocutor will now take on the role of your patient or the patient's carer or family member. If you have any questions, can you please type on chat? No questions? No? Okay, so let's now make sure that we understand how we are going to be graded or assessed during your role play. Now, it's split into two sets of assessment criteria. The first set is four linguistic criteria. You've got intelligibility, which talks about being able to speak clearly to others so that they can understand you very well. Second criteria will be on fluency. This means your speaking is smooth and at the right speed. It's not too fast and it's not too slow either. The third one is talking about appropriateness of language. In here, the best thing to use really that we try to advise our student is to make sure that you are using simple everyday language that your patient can understand. Always remember that medical words, medical terminologies, or medical jargons might not easily be understood by your patient. And if they cannot understand it, then it becomes an issue because they might not be able to follow your treatment recommendation, your advice, or your suggestions. So, appropriateness of language looks at your choice of vocabulary. And if you are using medical words, that you are explaining them in layman terminologies. So, it's very, very important. The last one under linguistic criteria is your resources of grammar and expression. In here, you need to express your ideas clearly and without confusion. So, when you're making a recommendation, when you are explaining, the medical condition to the patient, when you're giving advice or giving examples, always make sure that you check for understanding. Whether the patient understood all of the explanation or recommendations that you have given. So these are the four linguistic criteria. After this, you will also be tested on clinical communications criteria, and you will see 5 of them in here. So the first one is relationship building. This means that you are starting the conversation in a friendly and respectful manner. So when you do your introduction, always make sure that you are using your patient's name. Now, in OET, of course, we understand that sometimes you will panic and you will forget the name of the patient in front of you. When that happens, always remember that it's okay to give them any name. Okay, if you can call them Mr. Brown, Mr. Smith, Sarah, etc. As long as you use names of patients, okay, and your interlocutor will accept any names that you give them and will respond to them as well. So don't worry too much just in case you forgot. Okay, that is absolutely fine as long as you don't forget to give them a name. Okay, it's because whenever you're speaking to patients, it's always a good idea. You're talking to them, saying, "Oh, Sarah, I would like to remind you, Mr. Smith, I think the medical condition is called this." Using patient's name when you're conversing with them always tells the patient, this is a very friendly nurse, doctor, pharmacist, etc. I feel calm in front of them. It also builds up, understanding, and your patient can open up a little bit more. So the next one is understanding and incorporating your patient's perspective. Basically, in here, although you are the one being tested, you are the one who, being assessed by OET. Always remember that this is still a patient consultation, which means that you've got to do this in the same way that you do it in real life. So remember that you will be asking patients different questions in order to understand their medical problems. So understanding the patient's thoughts, their worries, and their expectations will be the things that will be incorporated or tested, within these criteria. The third one is providing structure, and this is really what we are going to talk about in more detail today. In providing structure, you need to organize your conversation in a logical way and make sure that you are clearly signposting or signaling whenever you're changing topics or whenever you're giving explanations or examples. Make sure that your patient clearly understands where the consultation is going. Okay, and this is the one that we will be talking about in more detail later on. The next one is information gathering. Just like in real life, you will be asking open questions, closed questions to your patient, asking for more details, asking for clarification, and then towards the end, majority of the times, you will need to summarize as well. Summarizing basically tells the patient that you've understood, you've listened to them, and that you've not forgotten anything. Okay, so information gathering, very, very important. Once you've gathered your information, then of course, that is the time that you as a professional will now be giving information. This is the time wherein the task will change from an ask, find out, okay, or confirm or explore into explain, recommend, emphasize, stress, highlight, etc. Because by this time, it is your turn to basically explain different information to your patient, clarify things that they're not, very familiar with or unsure of. Okay, and then at the end, once you've given your explanation, basically check for understanding and encourage your patient to share their reactions. Simple questions such as, is that okay? Or if you're recommending that, say for example, you want them to do more exercises, cut down on or avoid certain types of food, it would be a good idea at the end to basically ask them for their reaction. Is this something that they would be happy to follow, or do they think this is easy for them to follow or to be compliant with? Or if they have any concerns or worries about the suggestions that you've made, it's always a good idea to ask them towards the end as well. Okay, so these are the sets or two sets of assessment criteria that you will be tested on during your speaking role play. Now, we're going to move on and discuss the different stages of the patient consultation. And then within that one, I will then give you the different strategies or advice in terms of clearly signposting to the patient what's going to happen during the consultation, to signpost or to tell the patient that you are moving on to the next stage or asking a different question now or moving on to a different topic. Okay, so before we do those strategies, let's have a look at the different stages of the patient consultation. So the first stage is your initiation stage. In this part, basically, this is when we greet the patient and we establish rapport. Okay, this is also the area wherein we set the agenda for the consultation. So it's a good idea to tell the patient what's going to happen during the time of the consultation. Okay, so this is when you need to make sure that you remember your good morning, good afternoon, and you remember your patient's name. After the initiation stage, we are now moving on to the information gathering stage. It is this part wherein a lot of your questions will be asked. Okay, so you find out different verbs in your task, typically verbs that starts with find out, ask, or explore. And when we start the information gathering stage, we need to make sure that we are starting with an open-ended question. Open-ended basically means that the type of question wherein the patient is invited or encouraged to give you as much information as they can with regard to their current symptom or their current complaint. Okay, and then once they give you the initial information, perhaps the symptom, the trigger, the onset information, we then move on and continue with closed questions. So closed questions are now questions wherein you're digging a little bit deeper into the problems of your patient so that you can understand and diagnose it better. So if a patient comes to you and say, I have a back pain, your closed questions would include, where is the back pain? Is it the lower back or the upper back? Okay, closed questions are typically answerable by short answers or answerable by yes or no. So you'll say, is it the lower back or the upper back? They'll say upper back. Okay, is it the left side, the right side? They might say yes, left and right, etc. If you're talking about perhaps a swollen limb, you might ask, is it painful? Answer could be yes, answer could be no. Is it warm to the touch, etc. So we're basically trying to investigate a little bit more, and also at this time you're probably doing, in real life, you're probably doing some observations as well. But in OET, we do ask several different questions in order to gather information. Okay, and then once we've got the information coming in from our patient, we then move on to the diagnosis and the treatment stage. In this part, you'll be doing a lot of explanation. Okay. Now, within those explanation, OET will be giving you some samples. Within those examples, the good idea is not to simply explain in a very very long explanation, because again, if you don't break them down, okay, or if the explanation or the information is quite complex, it's always a good idea not to give them in one long go. The good idea is to make sure that we break them down so that the patient is able to follow our suggestion or our explanation. Okay, most especially when you are discussing treatment options, it's always a good idea to make sure that your patient understands your recommendation for treatment. And also, if you're asking them to avoid something, it's also a good idea to make sure that you emphasize the reason why you're asking them to avoid these things. Okay, so discussing treatment options, outlining the options, this will be option one, we've got another option, etc., is quite important when you are now giving your diagnosis and your treatment. And then finally, we are now moving on to the closing stage. So the closing stage will be your last bullet point. Okay. So by this time, you need to make sure that you are signaling that this is the end of the consultation. And by this time, we need to summarize key points from the discussion or the conversation that we've had with the patient. This is equally important because remember that your role play will need to last for 5 minutes. Your interlocutor will tell you when that 5 minutes is up. But once you've completed all the tasks, sometimes you don't notice them stopping you, or you don't hear that the interlocutor tells you that is the end of your role play, when that happens, it's a very good strategy to make sure that we summarize different key points from our discussion, and then check for understanding from the patient as well. Say for example, okay, at the start I've asked whether you know anything about asthma, and you said this is the first time you've experienced it, so you don't know much about it. I then explained all about asthma. I gave you some recommendations on how to manage yourself at home, and most importantly, I gave you information about the different people that you can contact when an asthma attack happens. And then that is a good summary already of what you've discussed. And then towards the end of that summarization, always make sure you check for understanding. So a very simple, I hope my explanation is quite clear. If there's anything that you would like me to explain further, or do you require more clarification, please feel free to ask, okay? If again the patient says no, everything is understandable, then during this closing stage, if your 5 minutes is not up, another strategy to use is to discuss the next steps or signpost future actions, such as coming back for a follow-up check, or as mentioned, maybe things that patient have to remember if none of the treatment option works, the medication doesn't provide relief, or if an attack happens, what can they do? Okay, so always a good idea to make sure that you know the different stages of your speaking consultation. Now, for these, we've got quite a few signposts that we can use to inform the patient that we are initiating the conversation, that we are going to be asking questions in an information gathering stage, that we are moving on to a diagnosis or a treatment, and then also to signpost closing stage. So for an initiation stage, you can say, good afternoon, Mrs. Smith, or you can say, so, Mr. Brown. Okay, I'm going to tell you why we've got two different ones. A good morning and good afternoon basically is something that we use when we are meeting the patient for the very first time, or they're coming into the clinic for the first time. We've not done anything to them yet. But sometimes your role play card will tell you that you've already checked their vital signs, or perhaps you've done something already, maybe an injection. Basically that means you're in the middle of the consultation already. This is not the start of the consultation. So when that happens, the good morning, good afternoon is not something that's ideal on your introduction stage, because as I've mentioned, you've done something for the patient already, and we don't say good afternoon or good morning once we've actually met the patient already. Okay, so two different ideas. I'm going to show you some examples later on. For information gathering stage, once you are doing your very first set of questions, open question, we can use before we begin, before we start, or before I do the injection. You can do that. Or you can say, first, let me ask. Okay. All of these words or phrases signify to your patient and to your OET assessor that you are starting the information gathering stage. Okay. And typically that's when your questions will have, may I ask, can we begin, let me ask, etc. Okay. Now, once you move on to the middle part of your role play, so this will be probably bullet point 3, bullet point 4. By this time, you are moving on to the diagnosis and discussion stage. You're not asking too many questions from your patient anymore, because you've already got the information that you need. You've done your open, you've done your close. So what you're doing in here now is basically transitioning to diagnosis or discussion stage. So you need some signposting that tells the patient that you are moving on to giving advice, recommendation, and suggestions. So you can say words such as, based on your symptoms, these are the recommendations that I would be providing for you today. Or say, for example, they're not very sure, what the symptoms they're feeling is all about, or they're very worried about, a particular symptom, then maybe once you've asked all your questions, you can then say, okay, I believe you are experiencing an asthma attack. Okay. And this is the first time, so you're probably not familiar with the symptoms, but an asthma attack, feels like these, and these. Okay. So again, before you do the information or the explanation, um, in order to get a good score under the providing structure criteria, it's always a good way to begin your explanation or information with signposting. The next one is on the treatment planning stage. So in here, you will now be giving advice on the treatment options that you've got for your patient. So you can say things such as, next, let me explain what we plan to do. Or for your treatment, I would like to start with, prescribing, let's say, for example, metformin 500 milligrams, 2 times a day, to be taken once in the morning and once at night. Okay. And then finally, once you've asked all the questions, you've checked the patient for understanding whether your explanations are clear, then we move on to the closing stage. Again, signposting, very, very important. So in this part, we use words such as finally, or I would like to stress the importance of. So before you do the verb on the very last bullet point, you can add the word finally, or you can use the phrase before you leave the clinic. Okay, so say for example, they are, working as you are working as a GP, as a nurse in the clinic. Then you say before you leave the clinic, or perhaps you are a pharmacist. And the patient has already received the medication that you've given, then you can say, okay, before you leave the pharmacy, I would like to give you some further advice, or I would like to ask that you check with your doctor if you experience any severe side effects for the medications that we have provided for you today. Okay, so all of these phrases are very, very good to to remember and to make sure that you are putting them in the right area. So let's begin on giving you some exact examples on the use of signposting. So initiation stage. So during your initiation stage, you will notice that your task includes the verbs ask or find out. Okay, and many of the role plays that you've probably seen on the sample test of OET will ask for the reason for the visit. So this is a good way to signpost this. Okay, so on the initiation stage, we're opening the conversation. Okay, so the beginning of the consultation, we need to make sure that we are outlining the main topics that we are covering. So in this example, you are a doctor, okay, and the setting is the medical clinic, and your patient is 86 years old, okay. So this is the very first thing that you look at when you're looking at the background, because the age signifies the type of introduction that you will use. Okay, what do you think is the significance of looking at the age? If your patient is 86 years old, how are you going to, greet them? Are you going to greet them as Mr. Brown, Mr. Robert Brown, or are you going to call them Robert? Okay. Now, Looking at the age helps you make a decision on the correct introduction, okay? Always remembering that your introduction needs to sound friendly and respectful. So, in this particular instance, we're basically seeing that we've got an elderly patient. So, it's always a good idea to use the formal style of greeting. So in this instance, we're going to say, "Good afternoon, Mr. Brown," as an introduction, and then basically introduce your name. So we can say, "Good afternoon, Mr. Brown. My name is Dr. Smith," or "My name is Sarah. Sarah Smith. I am one of the duty nurses today." Or if you are a pharmacist, "Good afternoon, Mr. Brown. I am Sarah Smith. I'm the pharmacy on duty today. How can I help?" Okay, so you can use a very simple good morning, good afternoon in this particular instance, especially because your first task is simply asking the patient the reason for their visit. So once you've given the introduction of good morning, good afternoon, the next thing you do is to signpost by using the word "let us start" or "let's start" by discussing what brings you here today. You can also ask, "Let me start by asking, what is the reason for your visit to the clinic today?" Okay, so a very nice and simple introduction. And as I've mentioned, this is something that is quite common within the OET roleplay, asking for the reason for the visit. Now, another common first bullet point in an OET task is the word "confirm." Okay, and in here, you're also going to be talking about the reason for visit. Earlier, we've got "find out the reason for the visit" or "ask for the reason why the patient is visiting today." But this time around, the word that was used is "confirm." Okay, so your patient is 51 years old. Okay, they've had a lesion removed from their hand. And the reason why you are meeting them today is you're going to remove the stitches. So if you look at your task number 1 tells you confirm reason for visit. Now, confirm reason for visit is not the same as ask reason for visit or find out the reason for visit. Ask and find out means you're asking the patient why they're visiting you. When you see the word confirm reason for visit, what you will notice is that OET will give you samples. Okay, these are in open and close parentheses. You've got removal of stitches, wound cleaning, and redressing. So a confirm basically means you are the one who will be informing the patient what you will be doing during the consultation. Because remember, if we go back to the background information, okay, the reason why you are meeting the patient today is you have to remove the stitches. So there's something that you have to do. So if you're going to do something, then you need to explain that to the patient. So a few tasks that you will notice, what you're going to do is you're going to confirm the reason for the visit, that you're going to remove the stitches, you're going to do wound cleaning and redressing. Then you're going to ask the patient if they have any concern. Once they've answered you, you're now going to give information about the medical condition. Then you're going to stress the need for ongoing prevention. And lastly, emphasize the reasons for the removal of stitches. So in signposting, we need to inform the patient what will happen during the consultation. So the first bullet point is the most important. So in this instance, we're going to again greet the patient. "Good afternoon, Mrs. Smith. My name is Grace Saunders. I am the nurse on duty today." Once you've greeted the patient, we now go into the signposting of the agenda. Remember, you have something to do. That is task number one. So you're going to say, let me begin by outlining what we have planned for you today. First, I will be removing your stitches. Then I will clean the wound site. And finally, I will change your dressing. We can also discuss your condition in more detail if you wish, and also talk about some preventive measures. Is there anything you would like to ask? Okay. So for task number one, which tells you you have to confirm the reason for visit, you've now got three samples or three lists. So that is remove the stitches first. So I use the signpost, let me begin. Okay. The second thing, basically from there is that the uh, the action that you will do is remove the stitches. So I use the word first. The second thing that you will do is to clean the wound. So I use the signpost then, which means this is after the first one. And I use the word and finally, meaning this is the last thing that I will do. Okay, so these are called signposting. Another signposting that I use is the phrase we can also. We can also means that I am giving the patient a sign that during the consultation, I will be giving information or explanation if they would like to. Okay, and that I am signposting that within the consultation itself, I will be talking about some um, preventive measures to help them manage, the wound. And then the other task that OET gave me is to find out if the patient has any concerns. And that's why I've added the question, is there anything you would like to ask? Which means I'm giving the patient now the chance to ask me any questions or to tell me if they have any concerns. Next, another verb that you will see is find out again, but this time around, it's not on the first bullet point anymore. This find out typically happens maybe the second verb in the first bullet point or maybe the second bullet point. Okay, so for this example, you will notice that I've done something for the patient already. Okay, in this example, I've assessed the patient and I've just taken the patient's vital signs. And then my first task says find out more information about this child's symptom. Remember that I am in this particular example speaking to the parent of my patient. So in this instance, again, I'll start with my introduction, but you will notice I'm not starting with good morning or good afternoon. Okay, the reason for that is if you look at the background information, I've done something to the child already. I've checked the vital signs, which means I'm not meeting them for the first time. I've already met them earlier. Okay, that means that the introduction in here is so Mrs. Smith. So it's a signal that means I've started something, I'm just continuing the conversation. So, Mrs. Smith, I've just taken the vital signs of Sarah. Before I discuss more about it, may I ask a few questions, please? So, this is signaling to the patient that I'm going to be asking several different questions. So, I'll wait for the patient's response and then I will then move on to my question. What you will notice is, again, I'm using signposting because I'm not just asking one question, I'll be asking a few. So my signpost is first, okay? So first, may I ask about your child's symptoms? How long has she been experiencing chest tightness, wheezing, and breathing difficulty? Okay, and then I'm going to ask about triggers and anything that could have caused it. Once you've done that, we then basically move on to other questions. I've used the signpost and then for my very last question, I use the signpost lastly. So in an initiation stage, always make sure that you are using different signposting that tells your patient or your listener that you are now starting the conversation. Okay, make sure that you outline the topics to be covered. For stage number two, we move on to information gathering. This is the time that you ask for ask questions from your patient in order to gather more information to start diagnosing and to start recommending different treatments, etc. So you can use words such as, now let's move on to, or the next thing that I'd like to discuss is, or thank you, let's move on to my next questions. Okay, all of these phrases or words signify that you are transitioning or moving on to a different topic. Okay, so for this example that we had earlier, you've asked the patients the reason for their visit. Now you're going to find out more details about their problem. So I use the signpost, let me start by asking, and then I ask the question, what is the reason for your visit today? And then I signal that I've listened to them. I use the phrase I see. And then I ask the question, can you tell me? Before I then signal that I'm going to be asking more question using the phrase, the next thing I'd like to find out. Okay. Now, when you are gathering information, it's always a good idea to summarize as well, because your patient will be giving you several different information or a lot of information. So we use signposting when summarizing as well. You can say, to recap what we've covered so far, or before we move on, I'm going to recap everything. And then make sure that you are listing what your patient had told you during the conversation. You can also in here basically transition into something else. Just tell them that what will happen next, but before you do that, that you're going to recap everything. Okay, and then simply list down the things that your patient had informed you. The third stage is your diagnosis and treatment stages. In this instance, you will see different verbs that says recommend, advise, suggest, emphasize, stress, etc. So for this instance, or this stage, your medical knowledge would definitely help you by explaining the medical condition, but always remember that there is a sample or some help within your role play card. At the end of your explanation, just make sure that you are checking whether your patient understood everything that you have explained. So a simple question such as, does this information make sense to you so far? Do you have any questions before we continue? Or even a very simple, is that okay? Um, as I've mentioned, there might be verbs in here that will say emphasize or stress. That means that you've got to make sure that your patient understands that this area is important. So using the word important or the synonym of the word important would be quite good during this task part. And lastly, in terms of diagnosis and treatment stage, because you will be talking a lot, it's very important that you follow chunking. Chunking is basically breaking down complex information into smaller parts to make sure that your patient understands everything that you are talking about. So we use first, next, then, also, may also, and then ask for understanding at the end. Do you think this is something you can continue to do? Do you think this is something that you will be able to follow? Or a very simple, is that okay, would suffice? We've now come to the last part, which is your closing stage. So in this part, we again signal the end of the consultation and we summarize different key points. So we use such a word such as to wrap up, to conclude, or before you leave. Okay. So when you decide to discuss or use different signposting, it's very important to understand various medical scenarios. You have scenarios wherein you are in a GP clinic. Really, in that instance, there's no emergency. Okay, majority of the times your patient will just come for a consultation or a follow-up. You might also have scenarios wherein you are visiting the patient at home, or perhaps the patient is actually in the hospital, maybe pre-surgery, post-surgery, or you're talking to them in the ward. Or as I mentioned, it might also be that there is an emergency scenario. So all of these medical scenarios and how to signpost during these scenarios, as well as how do you start the opening introduction, how do you transition between topics, and how do you close a consultation, is something that we teach you in during one of our or during our classes in SGR. So hopefully you've managed to get a few strategies and skills that will be very useful to you when you're doing your speaking role play. We wish you all the luck. Now, if speaking is something that is making you panic a little bit, or this is something that you feel you need some help with, you know, SGR does two types of coaching. We've got one-to-one speaking coaching, and we've also got the group speaking role plays. And we've got different speaking classes offered by SGR. We've got intensive coaching. This is one-to-one. And others also join our group speaking class. This happens every Friday. We've also got online speaking self-study, as well as speaking mocks. Now, speaking mocks are very helpful for those that feel very stressed, okay, or anxious about their speaking test, especially for those that have failed the speaking before. The speaking mocks would definitely be very, very helpful to you. So we've got, as I mentioned, a one-to-one and a group. We personalize lessons based on individual needs. We look at your strengths and your weaknesses. You've got access to our learning management system. This is basically includes practice activities, quizzes, mock tests, homework, etc. All our students have access to their own video recordings. They can watch them anytime at their convenience. And then for every homework, we do a comprehensive feedback. It's not just a case of we check, and then give you your score, but we actually provide a detailed feedback. Why did you score low? Okay. What were the particular problem areas? In speaking, we normally it normally would be speed, speaking too fast or too slow. Pausing for a very long time is a typical speaking error as well. So we discuss all of these points in detail so that you can improve. The other thing that we have, which helps a lot of our students, is that we give a free group speaking every Friday. This happens at 11 o'clock UK time, or about 6 p.m. in Asia, or roughly 1 p.m. somewhere in the Middle East. Okay, so all our students, if they are available on a Friday, rather than looking for someone to practice the speaking role play, they attend our class. I become their patient, or one of our teachers became will play the part of the patient, and they can practice with us every week. This makes sure that we make sure that you've got the confidence to attend on the day. Now, as I mentioned, we've got our in-house learning management system. This is an online intensive self-study. We give you different types of courses that you can pick and choose. So say, for example, you're interested in attending or taking on one of our intensive reading class. We've got the lessons listed on the left, and within those courses and lessons, you've got details, multimedia lessons, videos, PDFs that you can download, homework, etc. Okay, so we've helped quite a lot of students using this way. If you have any questions, even after this presentation, please feel free to ask. We are here to give you advice, especially for those that are struggling with their speaking, subtests or the listening, most especially reading and also writing. So you can get in touch with us via our WhatsApp. You've got the QR code on your screen. And if you'd like to find out more about the courses that we offer or a little bit more about us, then please do check our website, www.sgrfocustraining.com. Again, the QR code is on your screen. So thank you very much for attending. I hope you've learned some skills and strategies that you can use during your speaking role play. Thank you. Bye for now.